I think that's definitely like an interesting motivation that's there. Because number one, I think it shows like your dedication to medicine for
Mm-hmm.
sure. The fact that you're not just looking at how you can help patients in the future, but even now.
Mm-hmm.
And then also continuing to kind of show up and try to make whatever impact you can in those types of emergent situations where I'm sure there's plenty of patients and family that are in like some of the worst moments of their lives, at that time.
Yeah, for
And
sure.
yeah.
Like also in med school helps too, in where the viruses and the conditions and like the cardiac conditions I learned in med school definitely allows me to be better as a 911 EMT, because the training that I get compared to everyone else in my job is very different. For instance, I had a child who when we came in, her mouth was enlarged and she was drooling everywhere. She had a really bad fever. And because I have knowledge in viruses, I found out that this little girl had parvovirus and
Wow.
she did
Okay.
not get vaccinated at all. And this is a very contagious virus. And she said the rest of her classmates has it as well. So right away, I became very cautious. And my partner and I told him, hey, like, put on a mask and let's be very careful. Because I found out that the mom is also anti vaccine. But basically, because of med school education, it allowed me to be more knowledgeable with the conditions I treat and the conditions I handle. And then also, like yesterday, I had um, a patient with an aortic root dissection.
Wow.
So that was crazy. But because of med school, I learned how to, how to handle it and what to tell the doctors.
Yeah.
Because usually, other EMTs or paramedics, they would just take the patient in and they wouldn't
Okay.
really know what's going on.
Yeah.
But by the time I already got to the ER, I said, hey, this patient's having an aortic root dissection. Let's get this done quick.
Wow.
So that's why med school definitely helps. And I think more medical students should go into EMS because there are many patients there right now who need our help. And they don't go see doctors because health insurance is very high, and many patients just don't feel comfortable seeing doctors, and they wait till last minute to call 911. But when they get to meet healthcare workers like us, like medical students or just people who actually care for them, it changes their perspective on asking for help. And
Mm.
I encourage my patients all the time and sit with them and say, hey, like, let's schedule an appointment with you for your primary care doctor. Let's make sure you take your medications. Let me put your medication near the door so every time you leave the house, you'll remember to take your meds. Little details like that, although I'm only interacting with them for like an hour and a half, little things like that definitely change their lives. Because although, I see multiple patients, not many patients see multiple EMTs. So they will remember what I tell them. And my goal is to make sure my patients do not, make the same mistakes that they have done in the past.
Yeah.
Yeah.
I think that's definitely a really interesting point because one
Mm-hmm.
thing I think about quite a lot is I think even as we mentioned like earlier in the podcast, like there's
Mm-hmm.
definitely a lot of physician distrust that exists and for a
Mm-hmm.
variety of reasons.
Mm-hmm.
And one thing I never really would have thought of is the impact that I think people in shoes like mine could have, or shoes like yours could have,
Mm-hmm.
where just by being people who are able to show up and maybe be a little bit more relatable
Mm-hmm.
and show that like they really care,
Mm-hmm.
I think that's how we kind of help restore some of that trust in the healthcare system and how we're able to really provide care that's not only, trying to treat a particular disease, but is really trying to help that person and show that like you're there, to kind of help them whatever way possible, the situations they're in.
Yeah, for sure. And especially with CUNY School Medicine, we learn how to interact with racial minorities. And I think my training here allows me to connect closer with my patients, actually sit with them, have good bedside manner, hold their hands, and not tell them what to do necessarily, but feel their sadness, feel the stress that they're going through. Because I remember I had a patient, he was unconscious and he was having a heart attack. Um, and my partner drove him to the hospital, but I had to drive the wife to the hospital. So
Okay.
I was driving the ambulance. It was around 4:45 in the morning, and I vividly remember her sitting next to me, and her crying nonstop.
Mm.
And obviously, I could say, "Oh, like don't cry right now. It's gonna be all okay." No, like it's okay
Mm.
for families to feel sadness and stress.
Yeah.
So I remember while I was driving her, I was just telling her, let's get there, let's get to your husband, and let's really make sure he's okay, you know. And I try to distract her a bit with telling her about how each button works in the truck and try to lighten up her mood and talk about something different, because I don't want her to continue to stress herself and think about the worst case scenario. And she did feel happier, but sadly at the end, her husband did not make it. But I do hope that her ride to the hospital with me was a okay experience for her, because because of what I learned in CUNY Med, I learned to try to help our patients feel better. So yeah, that's a little small story.
Yeah. I think that story definitely tells a lot. I definitely appreciate you. I'm definitely grateful for you sharing a lot of these stories, because I think it's helping me kind of process some of the things that I think are important for medicine moving forward, and probably stuff I want to talk about on the podcast a little bit more myself. But yeah, I just think I think there definitely needs to be a strong focus on like being willing to just be with patients as people. Like, I feel like I kind of stress that along the podcast, but that's definitely something that I want to make sure that I keep a mindset of.
Yeah, for sure. Like, little things matter a lot with patients. For example, whenever I'm taking a patient, like let's say I'm giving my patient a wristband for the hospital. Yeah. They're going through such a traumatic time and they're sad and they're stressed, but little things could help them feel a little bit less stressed. For example, like let's say I give you a wristband. I say, "Oh, Mr. Jones, sorry, I don't really have a nicer watch, but this is going to be your new Rolex watch for your stay here, because, you know, it's a little wristband." Or I would bring Mrs. Smith to her bed in the, you know, the hospital room, and I would say, "Oh, Mrs. Smith, like, welcome to our deluxe suite here in Brookdale Hospital." You know, like, things like that. Although it sounds a little silly, it makes them happier and it lightens their mood. So little details do matter. And I hope more physicians and more medical students realize that. And also, I would highly suggest medical students to learn how to do CPR and how to administer Narcan and how to help a patient who fainted, because nothing's more embarrassing than being a medical student and seeing an emergency like that and not knowing what to do. Because everyone will go around and say, "Where's a doctor," right? Or does anyone know like medicine? And obviously we know medicine, but a lot of us do not know how to do those skills, and we would just be standing back. So I'd highly recommend all of us to learn these skills so we could help our